Hi guys, Sydney here in the AAFE Training Center. I have two of my lovely patients here, mother-daughter duo if you couldn't tell. Obviously pretty similar appearance. So we thought we'd run through kind of just the aging changes that go on and our treatment plans and how they vary on both of our patients. All right, so here we are just kind of taking a look at both of these beautiful faces. It's a really good representation of aging and just kind of what happens over time. So if you see some of these static creases from muscle movement over the years, that's kind of how those set in, as well as loss of fat pads in the cheek and just overall loss of volume. You can kind of see how these nasolabial folds form and these wrinkles form over time. These crow's feet, on Sammy we have a couple, but you can definitely see how they've worsened over the years. Looking at their lips, kind of loss of volume, and the vermilion border is a little bit less distinct. Yes, look at those. All right, and then coming on down to the neck, some of this crepey skin and what we call necklace lines or tech neck, since, we all like to be on our phones all the time. That's from, a lot of different things, but definitely the platysmal bands. If you look at Eileen's neck versus Sammy's and just the effects over time. So what we can do is, start treating Sammy now, and definitely with their treatment, their dosing will be different, and we'll kind of cover that once we get them into the chair. All right, still here, AAFE Training Center. We have Sammy in the chair. I already have some numbing cream on her because we are going to do a couple smooth threads in her nasolabial fold. So when we were kind of comparing the two faces, her, nasolabial folds are definitely starting to form that permanent crease. So we're going to try to kind of settle that down with a couple smooth threads. So I have her numbing. And then following that, we're going to do some Botox treatment. So we're going to treat her frontalis. Go ahead and raise your eyebrows. Good job. She has trouble making these faces, so we're proud of her. We're going to do a little bit of a brow lift on either side. She has a pretty small forehead, so we're going to be conservative with our dose. I think I'm going to start there with maybe 5 units. We will do a brow lift, 1 unit on either side. We're going to start treating these crow's feet. She's never had them treated before. Go ahead and smile for me. So these, although they're, I think they're kind of charming, they'll definitely get more permanent over time. So we're going to treat those with 9 units on either side. And then we're going to treat her glabella. So go ahead and try to make an angry face for me. Oh, that's good. She's not great at this, as you can see, but this area really bothers her. It's kind of where her eyes go in a photo. So we're going to just keep it really, really smooth with 20 units there. Hello, we are getting started with this treatment here. We're going to start with smooth threads. We're using twisted 29 by 40s. And Sammy knows that these are a little bit pinchy. She should be a tiny bit numb. All right, you ready? Mm-hmm. Okay. That's 1. Two. And 3. She handled it like a champ. Mm-hmm. Gonna give them a little twist and then they're coming out. That's it. So for that specific procedure, we will do another treatment in 3 months, and hopefully over time this soft line will soften even more. All right, I'm gonna come on to this side because this is my Botox side. We have her all marked up, obviously. So I'm gonna go ahead and start with her frontalis. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. You ready, Sammy? Mm-hmm. Okay. I didn't even ask her if she wanted a squeezy ball because I'm mean. Do you?
No, I'm just squeezing my finger.
Okay. Turn towards me slightly. All done with that. We will move on down. I'm just going to give this a quick wipe. Feeling okay?
Mm-hmm.
So Sammy has had Botox before, but she knows that she has these little kind of welt looking things. Those will go away in about a half hour, and they're not even bad. Moving on to the Glabella. She has very beefy corrugators, as you can see. Give that a little wipe. We're gonna do the brow lift quickly. Close real tight for me. All right, relax. Turn my way just a little bit. Close real tight. Great, relax. Done with that. How you doing?
Good.
Good. That's a quick wipe. All right, crow's feet, and we will be done. Always wiping up and away. Last one. And that's it. How you feeling, Sammy?
Good.
Good. So we already talked about post-care instructions. Sammy knows not to lay down, raise her body temperature, or touch her face for 4 hours. Sammy does work out a lot, so she's not going to go and do that right after this. And we talked about smooth threads. We'll see her in a month for her second treatment, and then a month after that for her third. We'll get her mom in the seat and go through that. Hi guys, here we are, still at the AAFE Training Center. We have Eileen in our chair. So we have her all marked up. Getting a pretty similar treatment as Sammy. We're doing 3 areas, the frontalis, the glabella, and the bilateral crow's feet. Dose is definitely different. She has a bigger forehead than Sammy had, and these static creases are a little bit more prominent. Definitely some more strength here. If you can go ahead and raise your eyebrows for us. Perfect, and then make an angry face. She's much better at making the angry face than her daughter. And then these crow's feet. So we are just gonna go ahead and get treated, okay? All right, you ready? A little pinchy. Doing okay?
Mm-hmm.
She also, the skin, you can probably tell just how my needle's going in. her skin is thinner. She's it's much more easy to get my needle in there than it was for Sammy. And these will get a little pinchy as I get to the other side. Just slightly. I can also tell by the way my needle is going in and by her wrinkles that her muscle is thinner than Sammy's. So just, again, all related to aging, and just kind of keeping in mind that their treatment plan will differ a little bit. Moving on to Glabella. So we're gonna just inject this beefy muscle. All right.
Mm-hmm.
All right, we are moving on to crow's feet. So here we're doing 4 injection sites just because we are a little bit more active. And I double check my placement one more time. These are a little pinchy, I apologize. Very important to wipe up and away here. We don't want to have any of that product migrate. All right, last site. Eileen is a trooper. All right, that's it. Thanks for stopping by. And thank you to our wonderful, tolerant patients.